June was Migraine and Headache Awareness Month, an important time to raise awareness and learn from more about migraines, a debilitating neurological disease, including a recent FDA approval of an additional preventive treatment option for those living with chronic migraines. Now, here to talk about it is Dr. Hope O'Brien, neurologist and founder and CEO of Headache Center of Hope, and Kelsi Owens, a working mother living with migraines. Good morning, ladies. How are you?
Good morning.
Good morning, James. Thank you for having us.
Thank you for joining us. Now, Dr. O'Brien, what is migraine and what is the difference between episodic and chronic migraine?
So migraine is not just a headache, but it is a complex neurological disease that affects about 40 million patients living in the United States. It's characterized by moderate to severe head pain that can last anywhere between 4 to 72 hours and is associated with light, sound sensitivity, or nausea and vomiting. And it can be very impactful and disabling to patients, and in fact one of the leading causes of disability among individuals under the age of 50. And one of the reasons why Kelsi and I are here partnering with AbbVie, the maker of Qulipta, to raise awareness on an important milestone in migraine.
So, Kelsi, how does your disease impact your life personally and professionally?
Yeah, I have been living with episodic migraines since I was 6 years old, so about 30 years, and it impacts just about every area of my life. I am a mom, have a very active 7-year-old daughter, and it's really difficult to explain to her why sometimes I can't do really normal things like take her to the playground or even just get out of bed and make her a snack. Professionally, likewise, I may have to step away with very little notice, and my team has to scramble around pushing deadlines or rescheduling meetings, or even taking on some of that additional workload with me being out. So it can be really hard to manage.
Now, doctor, what can you tell us about preventative treatment options for people with migraines?
Sure, so the landscape of migraine treatment has expanded, and Qulipta is the only oral CGRP once daily prescription medication indicated for the preventive treatment of both episodic and chronic migraine. And when we think about the difference between those two, is episodic migraine is defined as having 0 to 14 headache days per month, while chronic migraine is defined as having 15 or more headache days per month, of which 8 of those days are impacted by migraine. The most common side effect of Qulipta is nausea, constipation, fatigue, and sleepiness. And for those of you that are allergic or have a sensitivity to Qulipta, it's important that you not take the medication, as it can cause a severe allergic reaction, including anaphylaxis. And it can occur the day of taking the medication or days later.
Now, doctor, how does Qulipta work?
So Qulipta works by blocking an important molecule believed to be a cause of migraine called CGRP. And by blocking this molecule, it actually decreases the frequency of migraine over time.
So, Kelsi, what is your experience with Qulipta?
Yeah, I mean, I didn't know that there was anything I could actually do to prevent migraine attacks. But since starting on the medication, I do have fewer migraine days. It is easier to go through all of my daily activities. So it's really made a huge impact on my life.
So, doctor, where can our viewers go for more information?
Sure, so I would encourage patients to please talk to your neurologist, headache specialist, or healthcare provider to see whether or not Qulipta may be an option for you, or you can visit the Qulipta website at qulipta.com or call 1-855-QULIPTA for more information.
Dr. O'Brien, Kelsi, thank you so much for joining us on Morning Blend.
Thank you.
Thank you, James.